So let's talk about the nerve supply of larynx and nerve palsy. So recurrent laryngeal nerve, it supply all the entrancing muscle of larynx except cricothyroid. All the abductor and adductor of larynx is supplied by the recurrent laryngeal nerve. Only cricothyroid is supplied by the superior laryngeal nerve, and superior laryngeal nerve has two branches, that is cricothyroid and external branches and internal branches. So external branch supply the cricothyroid, internal branch supply the sensory supply above the vocal cord, and sensory supply below the vocal cord, it is supplied by the recurrent laryngeal nerve. Okay, now let's talk about if there is a unilateral superior laryngeal nerve palsy. So what will happen if there is unilateral superior laryngeal nerve palsy? So if there is unilateral superior laryngeal nerve palsy, so it superior laryngeal nerve supply the cricothyroid. So cricothyroid will not be supplied, and what is the action of cricothyroid? It tenses the vocal cord. So so basically cricothyroid action is to increase the pitch, increase the pitch of voice. Okay, so if there is unilateral superior laryngeal nerve palsy, so the pitch is affected. Okay, if there is bilateral superior laryngeal nerve palsy, so patient will have severe inability to produce high pitch sound, very monotonous voice, weak voice projection. Okay, so both side cricothyroid muscle are paralyzed, vocal cord cannot tense, pitch modulation is absent. Okay, so these all are the features of unilateral superior laryngeal nerve palsy or bilateral superior laryngeal nerve palsy. Now let's talk about the vocal cord recurrent laryngeal nerve palsy. And obviously the because superior laryngeal nerve supplies the sensory part of above the vocal cord, so sensation of vocal cord is gone. Okay, now let's talk about the unilateral recurrent laryngeal nerve palsy. So in case of unilateral recurrent laryngeal palsy, it supplies all the abductors and adductors except cricothyroid muscle. So patient will present with, in unilateral recurrent laryngeal nerve palsy, patient will present with hoarseness of voice, weak cough, mild aspiration. Okay, and the most common cause is thyroid surgery, because thyroid is in close relation with these nerve, recurrent laryngeal nerve. Okay, if there is bilateral RLN recurrent laryngeal nerve palsy, then patient require urgent tracheostomy, because both vocal cord will be in median or paramedian position, so air cannot go inside. So this is life threatening. Patient needs urgent tracheostomy. Okay, so this is bilateral recurrent laryngeal nerve palsy. If both uh, superior laryngeal and recurrent laryngeal is injured on the unilateral side, then patient will present with aphonia, respiration is normal, and you have to do the medialization. If there is bilateral, then you have to do tracheostomy. Okay, so this is nerve palsy in larynx.